Hey guys, this is Curtis Alexander. I'm a pharmacist. In today's video, we're going to go over part of our 101 series for amoxicillin. So in the 101 series, I'm just covering like a 35,000 foot overview of the medications, what it's used for, dosing, side effects, those sorts of things. So I just want to hop right into it. So amoxicillin is one of those medications that pretty much everybody's heard of. It's an antibiotic, been around for a long time. Overall, good drug, but there are some downsides to it, which we'll discuss. And at the end of this, I'm going to kind of give you my takeaway as a pharmacist, what I would tell you if you were a family member who's considering it. So at any rate, let's hop right into it. So first of all, I think it's important when we're talking about the medications to understand how they're working in your body so you can better understand sometimes why side effects occur, why they work. Just helps you helps you understand what the medication is actually doing. So it basically, when you take amoxicillin, bacteria, just like any other cells in your body, have to build cell walls, to have a cell structure. Amoxicillin goes in and actually, through a process, blocks the building of those cell walls so the bacteria can't have a functional cell wall, and it kills them, more or less. So one of the things that we know about amoxicillin is you have to use it for what are called beta-lactamase negative type bacteria. Now there's beta-lactamase positive bacteria, and the reason that you can't use amoxicillin with a beta-lactamase positive bacteria is that it's going to break up this beta-lactamase ring. It has an enzyme that can break that up. It makes the antibiotic ineffective. So it is actually very important that we make sure we're treating the right types of bacteria, and they tend to occur in certain infections. So one of those, there's a few of them, but so you're going to tend to see amoxicillin used to treat a fair number of ear, nose, and throat infections. It could be anything from tonsillitis, otitis media, which is common ear infection. Those are usually beta-lactamase negative bacteria. We can use it in H. pylori. I talked about that in the omeprazole video. You can use omeprazole, amoxicillin, some of these medications in combination to treat H. pylori, which is a bacteria that lives in the stomach. Next, we can see it used in stuff like pneumonia, sinus infections, and UTIs. So two of the big ones, ear infection, sinus infection, are huge uses for amoxicillin. Now, one thing to point out, we really want to be using antibiotics for as short of a period as possible. Usually 7 to 10 days for a lot of antibiotics is what we see. And one of the problems that you can see is if you tend to use it for longer periods, and there's some people that'll go 2 months or more using amoxicillin, you start to see the development of super infections. And so one of these things, an example of that would be Clostridium difficile associated diarrhea, the CDAD. So we're killing off bacteria, and then we can get overgrowth of other bacteria over this extended period of time. And so people will develop this severe diarrhea. So we really want the amoxicillin to be ideally a 7 to 14 day regimen, no longer than that unless we absolutely have to. And if we do, we definitely want to try to keep it under 2 months. We are probably going to run into problems. The other thing to keep in mind is if you have any form of kidney problems, you're going to want to adjust the dose downward. If we don't, we're going to run into those same sort of dosing problems we talked about earlier. Speaking of dosing, the normal dosing, the 500 milligram capsule is very common strength, so we can do 1 to 2 of those every 8 hours, and it needs to be scheduled. We'll talk a little bit about that in a second. Now, why the range? On the low end, we're going to be looking at less serious things. I don't know a better way to put it, but not that ear infection isn't serious, but ear infection, you'd probably be looking at 500 milligrams every 8 hours. For something a little more serious like a pneumonia, we may get up to that higher range, 1,000 milligrams every 8 hours. So that's kind of why we have that range. Again, this is on a scheduled basis. You don't want to be taking an antibiotic as you need it. It's not going to work. We're going to introduce antibiotic resistance, those sorts of things. Okay. How about adverse reactions? How about side effects? So the main thing we look at is somebody going to have an allergic reaction, and if they do, it's going to show up as a rash, as hives, those sorts of things. If it pops up, we usually see it within 1 to 6 hours of that first or second dose. We can see it later. We can see people develop those allergies 7 to 10 days out. Not as common, but it can happen. Outside of that, it's actually really well tolerated. We talked a little bit about the diarrhea. As long as you're staying in proper dosing regimens and you're not giving it too long, diarrhea isn't a huge concern. Vulvovaginal infections can happen in roughly 2% of people. Nausea and headache, 1%. So you can see that while there are some concerns, they're fairly minor. Again, as long as we stay in our dosing windows and don't use it too long, it's usually pretty well tolerated. So biggest thing we worry about, and we touched on this, was if you have a penicillin allergy, amoxicillin is not a medication you would want to be using. I will say though, however, in my experience, the amount of people who say they have an allergy, who truly do have an allergy, is much lower. And trying to remember the doc's name, but he came out and basically said they went and did studies on this, and the people who claimed a penicillin allergy or an amoxicillin allergy, only like 5% of them actually had the allergy. So just keep that in mind. I'm not saying you should use it, but when somebody says they have an allergy, my first question is, what happened? If they go, man, my throat closed up, had trouble breathing, that's a true allergy. But if they're like, oh man, I got really sick to my stomach, it's not an allergy, that's an intolerance. You could still take it in that case. Okay, so biggest takeaways here. Amoxicillin is a good drug. It's been overused though, so it's lost some of its effectiveness. We're starting to see more antibiotic resistance to it. So antibiotics are great medications. We just haven't done a good job historically of using them in the right places. But when it is, if it's used for a beta-lactamase negative bacteria and dosed properly, it's great medication. The other thing we want to keep an eye on is the kidney disease and the dosing that we talked about earlier. Finally, we harp on this all the time as pharmacists. You got to finish everything. Even if you're feeling better, finish it all. We don't want antibiotic resistance to rear its ugly head. So if you have other questions or comments, post them in the comments below. I do read all them. As I do more videos, it's very hard for me to respond to all them, but I promise I read them. So if you want me to cover other videos, just put that in there and I'll try to catch it. Subscribe, like, all that stuff. One other thing, if I come across a lot of people, they're on medications and they want to improve their health, they want to get better, but they're looking for other options that are available. I cover a lot of those in my newsletter, and I'll give you a free 30-day report. It's one lesson every 3 days. It's called 30 Days to Better Health. It's some of the things I do. It's some of the things I no longer do. For example, supplements that I no longer take that can actually hurt people. But if you're looking for other options outside of medication, surgery, those sorts of things, go to curtis-alexander.com and just sign up. It's free. Like I said, I want people to know more about these things. So go there. I put a link below too, so go check that out. And I hope this video was helpful for you, that it was valuable. And until the next one, I hope you have a good one, and we'll talk soon. Thanks.